In this webinar, we will review some of the benefits provided by the University Student Health Insurance Plan, also known as USHIP, as well as review USHIP premiums and billing. As a reminder, premiums are what you pay up front in order to be enrolled in USHIP. We will also provide an example of how USHIP would cover a $5,000 medical bill, compared to other comparable coverage plans. Before we start talking about your USHIP coverage, it is important for you to know that there are people on campus dedicated to helping answer your questions about USHIP. Steffi works for United Healthcare Student Resources, our student insurance carrier, and is located on campus in the Student Wellness Center. Any questions about your USHIP policy benefits, claims or enrollment questions should be directed to Steffi. Celia works for the university and can answer your questions about the university's policies regarding student insurance. Now let's take a look at how the USHIP coverage is structured. Your annual deductible for in-network providers is $400, or $800 for out-of-network providers. Annual out-of-pocket maximums if you seek in-network care is $2,500, versus $3,750 for out-of-network. The co-insurance under the USHIP plan is 10%, which means that the plan pays 90% after your annual deductible has been met, and you will pay the remaining 10% until you reach your annual out-of-pocket max. Prescriptions are paid on a tiered copay basis at in-network pharmacies. Typically, generic brand drugs will fall under Tier 1 and have a $10 copay. Name brand drugs will fall under Tiers 2 and 3, which have copays of $25 and $40 respectively. There is a $20 copay for in-network doctor, specialist, and mental health visits outside UChicago Student Wellness, and a $10 copay for psychotherapy visits with specific community providers on a list available through UChicago Student Wellness. USHIP is part of a national network, United Healthcare Student Resources, and you will have insurance coverage whether you are at school, home, or anywhere away from campus. If you live or travel abroad during the plan year, international coverage is included and reimbursed at an in-network rate. Additional benefits include global emergency services when you are traveling abroad, on-campus insurance support, a nurse advice line, and telehealth for 24/7 access to a physician, nutritionist, or mental health provider. There are many ways you can get the most out of your USHIP benefits. If you are living on campus or near campus, UChicago Student Wellness is able to provide your primary care at no cost. If you choose to see a provider outside UChicago Student Wellness, we recommended you choose an in-network provider, as your out-of-pocket costs will be much lower. Also, the DCAM Pharmacy has a special arrangement with USHIP. You can receive 90 days of prescription for the price of only 2 months copay for most medicines that address chronic conditions. DCAM is located on the first floor of the Duchossois Center for Advanced Medicine, DCAM, building, around the corner from the Student Wellness Center at 58th and Maryland. Lastly, you should review the lists of exclusions and limitations on USHIP before obtaining services outside UChicago Student Wellness. Not all procedures are considered eligible expenses. For example, elective surgeries are generally not covered by USHIP. If you have questions about coverage, you should contact the on-campus student health insurance representatives at UChicago Advocates at uhcsr.com. Now that we've talked about the benefits available on USHIP, let's discuss the costs. This slide shows the USHIP premiums for the 2026-27 academic year. Remember, the premium is the cost you pay per year to be enrolled in USHIP. For a student, the annual premium is $5,517, which is broken out into 3 quarterly installments of $1,839. The exception is medical school students who are charged the annual premium on their autumn bill. If you need to add a spouse or partner or a child, that would be an additional $5,517 per year. For a spouse, partner plus 1 child, your total cost would be $16,551, and if you have a spouse or partner plus 2 or more children, the annual family rate would be $21,936. If you were admitted with a funding package that includes health insurance, you will not be charged the annual premium for health insurance if you enroll yourself in USHIP. This includes PhD students who are required to enroll in USHIP. However, if you have dependents and enroll them in USHIP, you will be charged for their premiums, and if you choose a health insurance plan other than USHIP, it will not be paid for as part of your funding package. USHIP premiums are included on your bill from the university's bursar's office in autumn, winter, and spring quarters. USHIP coverage begins September 1st and continues through August 31st, though you will not pay a summer premium. If you will be starting school any quarter other than autumn, You can view your billing cycle at studentinsurance.uchicago.edu. Please note that you are automatically assessed an insurance fee on your student account. However, you must confirm your enrollment in USHIP in order to activate your coverage, or you must waive USHIP coverage with alternate comparable insurance in order to have the charge removed from your student account. We realize that premium costs may seem high, especially for those of you not familiar with the U.S. healthcare system, so we want to include a comparison of the USHIP plan and two other plans that we know meet the comparable coverage requirements for the university. USHIP is a platinum-rated plan under the Affordable Care Act, meaning it is in the category of plans that pay the most to cover your healthcare costs. As you can see, the premium for USHIP is lower than the Blue Cross Blue Shield of Illinois' PPO Gold option and the UHCHMO Gold plan. USHIP's deductible of $400 is lower than that of Blue Cross Blue Shield, or BCBS, and UHCHMO, as is the annual out-of-pocket maximum. USHIP also provides a higher co-insurance rate of 90%, compared to 80% for the other plans, meaning USHIP would cover a higher percentage of your healthcare costs. To consider how these factors will impact your healthcare costs, let's look at a real-world example. If you were faced with a $5,000 medical bill on each of these three plans, you can see that you would end up paying significantly less out of pocket on USHIP. On USHIP, you would pay $860 out of pocket for that $5,000 medical bill, while if you had the UHCHMO plan you would pay $2,600 or $1,960 on the Blue Cross Blue Shield plan. This example demonstrates why it is important to consider the deductible, co-insurance, and out-of-pocket maximum when looking at alternative insurance plans, not just the cost of the premium. For more information on USHIP benefits and premium, please visit the student insurance website at studentinsurance.uchicago.edu.